This is a replay of Let's Talk Nigeria on Sparkling 92.3 FM Calabar, making Nigeria better, one conversation at a time.
We talk everything. Health, education, finance, sports, transportation, agriculture, politics,
entertainment,
people and power on Let's Talk Nigeria. Let's Talk Nigeria. Every day of the week from 9 a.m. to 10 a.m. Only on Sparkling 92.3 FM Calabar. Your radio, your charm.
And yes, hello, welcome to Let's Talk Nigeria on Sparkling 92.3 FM Calabar, Cross River State, Nigeria. Today we're talking about something really important. The focus is on health. The focus is on tuberculosis. And according to the statistics that we have here, this statistics is on the website of the KNCV Nigeria. And TB is the #1 infectious killer disease in the world, and among the top 10 causes of death worldwide. That's scary, right? But this TB is preventable, and it's also treatable, right? So that's the consolation there. Now, more statistics show that 1/4 of the world's population, approximately 1.9 billion people, is infected with TB, live with the causative organism in a dominant or inactive state. Also, every year, it is estimated that 10 million people develop active TB disease following reactivation of the dominant organism or from community transmission of active forms of the organisms. Now, of these, approximately 1.1 million are children and 860 people living with HIV. The sad thing here is that 3 million people miss out on care and treatment annually. Another 500,000 develop a drug-resistant form of TB, with only 1 in 3 able to receive the appropriate treatment for this drug-resistant TB. Why is that so? It should not be so. Now, we have the stats showing that Nigeria has a high triple burden of TB, and also drug-resistant TB and HIV-associated TB, and is one of the 10 countries that contribute the highest number of missing TB cases globally. Why is there a missing TB case? And this is globally. Nigeria also ranks first in Africa and 6th in the world, accounting for about 4.6% of the global TB burden. An estimated 15 Nigerians die each hour due to TB, equivalent to about 347 deaths daily, 10,417 monthly, 125,000 in a year. Now, Nigeria's TB incidence rate is about 219 in a 100,000 population, with an estimated total of 467 persons who have active TB disease. In 2021, the National TB, Leprosy and Buruli Ulcer Control Program notified 207,785, having a gap of 56% of the estimated cases unidentified. Today is World TB Day, and yes, we can end TB when the right thing is being done, right? When the right thing is being done. So I'd like you to listen attentively to today's program. Do well to ask questions where you need to ask questions, and seek for clarifications where you need to seek for one. This morning, I have my guest, and another one will join us shortly. I have the program manager, Cross River State Tuberculosis, Leprosy, Buruli Ulcer Control Program, and the person of Elder Mrs. Ajom, Odey, Ikongha. Good morning to you, ma. Thank you so much for coming to the studio.
Good morning, everyone. Good morning, our listeners.
Thank you. And also, we're being joined by Dr. Enoch Asuquo. He is a program officer of the KNCV Global Fund. Good morning to you, Doctor. And Enoch, thank you so much for coming to the studio.
Good morning. Good morning. Thank you for having me. Good morning, Perseverance. I'm Dr. Enoch Asuquo. It's nice to be here. Thank you.
All right, let's start the conversation this morning. The phone lines, you already aware of them, but I will call it again. I'll call them again. 0812-723-7060. You can also send a message when you need to, or if you don't want to call in because of your identity, but there's nothing to be afraid of. Now, this morning, let's start talking about TB, because every year the world observes this day, 24th of March, as the World TB Day to amplify the urgency of ending tuberculosis. I'd like to ask you, let me start with you, Dr. Enoch, where are we in ending TB?
Okay, thank you very much. I would say we are doing a great job in ending TB. We are not there yet. We are, I would say, 60-70% there, because the Global Fund and the USAID are doing so much to try to end TB, especially in Africa. And so much is being done so far, and investment is still ongoing. Like you see, this year's team, which says commit, invest, and deliver. So we are trying to invite partnership. We're trying to invite more stakeholders to commit and invest into tuberculosis. So we are still trying our best, and we hope that TB will end one of these days. It's a disease that's preventable, and if it's preventable, that means that we need more resources, more HR, more people to commit and invest into TB to end TB at the end of the day. Thank you.
All right, thank you very much. We'll come back to you. Let me get to Elder here. Let's talk about TB and how someone can get infected with the disease.
Okay, thank you very much. What is TB? TB is just an acronym, is tuberculosis, and is a chronic infectious disease caused by a mycobacterium tuberculosis. This disease can be gotten through airborne. That is when you are in an environment where there's an infected person who coughs, sneezes, speaks into the air, you can then inhale it. And if your immunity is not very strong at that moment, you may develop tuberculosis. Or whenever other chronic ailment emerges, you will come down with tuberculosis. Meanwhile, we have two types of tuberculosis. We have the pulmonary and the extrapulmonary. The pulmonary TB is the one that dwells in the lungs, and that is the most dangerous one, because the infected persons will be coughing regularly, while the extrapulmonary is TB of any other part of the body.
All right, thank you very much, and I hope you listening, you're getting the information here, how someone can come down with TB. You mentioned the two types of TB, the pulmonary TB and the pulmonary TB. Now, Dr. Enoch, there is the drug-resistant TB, and that one seems to be dangerous. How do people get down with that?
Okay, when we talk about the drug-resistant TB, this is detected when we have samples being collected from people that presume to have TB, and then when we do the analysis, we find out that they have a resistance on the microbiology aspect, or the gene experts. We see that there's a resistance to rifampicin, and that shows that there's a DRTB in question. So what happens that way, we try to ensure that we pick these patients and take care of them, give them the right treatment for them, follow them up and their caregivers to ensure that they are actually taken care of and reduce the spread of DRTB, which is a very serious strain of the TB virus, the TB bacteria.
All right, so Elder, what are the signs or the symptoms that one would notice and say, okay, I think I might have TB? Okay, what are the signs or the symptoms that someone can notice and say, okay, I think I might have TB?
Oh, well, prolonged cough for more than 2 weeks or of any duration. fever, chest pain, tiredness, loss of appetite, coughing out of blood, that is hemoptysis. So once you see such or you have such signs and symptoms, please, you rush into the hospital or any primary healthcare center.
Okay, I know that TB also affects children, Dr. Enoch. Yeah. These symptoms, are they also what you find in children?
Yeah, mostly they're not classical symptoms in children. Basically, but what we try to do for the children is to ensure that we do rapid screening for them using the X-rays and their stool samples. They may not classically show those signs and symptoms, but basically when we have those screening stuffs being done, you could actually find out that they do have this TB embedded in their system. So basically, you may not see these classical symptoms as it's described in a full-blown adult. You might have basically see from the screening exercise, we have the X-rays. Right now we have what we call the portable digital X-rays that are in the communities, in the field where they do screening of these children to ensure that they actually have this. If you don't have this, then you know what to do. Then also there's stool samples to do analysis for the TB to ensure that they do have it or they don't have it. So that is being done. So the symptoms are not really classical in children.
Okay, for a parent who is listening now. Okay, so for a parent, Elder, you want to add something? For a parent who is listening to this program, what signs will the parents see in the child to say, I think my child needs to go to the hospital? Elder, please help me there.
Okay. When the child is not thriving well.
Thriving
well.
Okay.
For instance, maybe a child is supposed to walk at a certain age, and you can see that the feeble bones are weak, and then the child is also being fed very well, but it's not looking as if that's the child that is really
eating well
fed. Yes. So, and then malnutrition can set in. So those are little signs you can see in children and really know that this child is actually not developing very well according to the age of the child.
Okay. All right. At the start, I read out earlier here, says that an estimated 15 Nigerians die each hour of TB. Dr. Enoch, that's scary. Why is that so?
I think it's basically now that we have the investment part of it coming into where we have the global fund, and you said where we go out the communities to reach out to these people to ensure that we do the screening in the community. So you see, these statistics are scary, and they are part of the research to exactly know exactly what's happening in the community to ensure that we pick out these people on time. So basically, we still have that 15 to 1, but the mortality rate you just point out now, it's there, it's a reality, and if we don't commit and invest in tuberculosis, at least this will get worse. That's a reality for us to actually put down going forward.
Okay, so we also saw something like there are missing cases. I'm trying to remember how I read it out earlier. There are missing cases of TB. Can you help me understand that? I'm Elder.
Yes, there's missing cases. Scientifically, it is believed that per every smell positive case is bound to infect 10 to 15 persons.
Every one case
in a year. And if, for instance, just that statistics you've just mentioned, let's assume times one case, you really know that we have not done enough. There are some persons still out there that need to be searched for. And that brings us to this year's theme, commit. Everybody needs to commit, deliver, and ensure we are all searched and be brought to treatment.
All right. Someone had asked the question before, what is the difference between tuberculosis and whooping cough? Dr. Enoch.
Okay, when you say whooping cough is what we call medically croup. Yeah,
croup.
It's croup. Yeah.
Okay.
This is I don't know how to explain it for the mere medical without medical jargons.
Jargons.
Yeah. Okay, but whooping cough is more like a system generated how do I explain it now for you to understand? It involves the whole respiratory system where this cough kind of sounds like a noise, like very noisy cough, and it involves the whole respiratory system, and it can happen at any age. Okay, so but for the TB is we can't say classical cough for TB, but basically, when we have any cough of any nature and it lasts longer than 2 weeks, the best is to go for a screening exercise, do a drainage part, or use our portable digital X-ray to ensure we screen the patient for TB. So there's no classical cough to say this is particular to TB and this particular whooping cough. A whooping cough can be so disastrous that you could get a whoop in the coffee whenever you have have a patient of that nature.
Okay. Now, we have, in the course of this conversation, talked about children coming down with TB, right? Aside children, who else can get? What is the age bracket for someone to come down with tuberculosis?
Well, we will say there's an age bracket. It affects all around. Okay. Affects all around. There's nobody that's immune from that, but it affects people that are actually have
underlying sickness.
Underlying sickness. Comorbidity. Yeah. So if they have that, they could be more prone to tuberculosis. Like people that have human immunodeficiency virus, like the HIV we know about, and the AIDS. So if they have those that kind of disease condition, they are more prone to TB. So it happens at any age. There's no particular demarcation for that.
All right. As we progress into other questions, you can call in and ask your own question, 0812-723-7060, or you can call 009-230-0022, numbers there. And also you can send a message on WhatsApp if you have noticed anybody around you in your compound or very nuclear family member, or even yourself, you have been having this sort of cough. Please do well to call in and get your questions answered here. 0812-723-7060 or 009-230-0022. Now let's get to another aspect of this conversation, which has to do with the testing for TB. How do we go about the testing? Let me start with Elder there.
Okay, like we said earlier, you can access TB treatment in any of the facilities, teaching hospital, general hospital, primary health care centers across the state. Once you notice that you're coughing, walk into any of those facilities and then you'll be instructed. A container will be given to you, we call it sputum mug, will be given to you. You produce your specimen. That will be taken to the gene expert for analysis. Thereafter, if it's positive, you will now be told that you are positive. Okay, but not just the government facilities. Currently, the program is also involving the patent medicine dealers and some community pharmacies. So the program had gone ahead to train most of them so that whoever goes there as a first point of call can be directed on what to do.
Okay. Now, you've talked about the testing. Let's talk about the treatment, right? What is the treatment like?
The treatment is free.
Free?
Yeah, it's free. It's free of charge.
At any facility that you enter?
Any facility is free of charge. The drugs are really available. You get it's a 6 months course. They are readily available for anyone that is positive to tuberculosis. So it's readily available for them at any point in time.
Okay, I'm going to ask this question. The USAID aid funding cut and all of that, we have seen a lot of narrative around that it has affected the supply for TB drugs, HIV drugs, and all of that. How is that for us here in Cross River State?
Okay, the USAID funding, Donald Trump did that and cut out to review the US policy on the USAID, and that happened, and I think it happened for like about 6 weeks to 8 weeks. But currently, our USAID funded program is back, fully on course.
It's back.
Yeah, they have resumed on the 17th of March. This March, they are fully back on course, and we have no cost to alarm for our medications and our supplies of TB kits and TB drugs. So we are fully back. So we have both the USAID funded program, we have the Global Fund funded program, which I'm the head of the Global funded program. We have Dr. Cynthia, who is the head of the USAID funded program. So we are fully back on track for Cross River State. Our testing, our delivery of services to the hooks and crannies of Cross River State are still very much intact. So we are still very much available. So thanks to the US government who has called back the USAID funded program, and we are happy that we have started implementing and they are ongoing for the next 1 year.
Okay, let's talk about treatment for individuals with comorbidities, right? Now, for someone who has HIV and is coming down with TB, how is it?
Yeah, when someone that has HIV and comes down with tuberculosis, the HIV was the main issue when the person presented. You find out that HIV is more like the Ogade before TB
came in.
So the HIV has helped to break down the body system and then allowing the latent TB that was there to show itself. So there are treatments for both of them at every cost during the HIV treatment. So there's full treatment for HIV TB infected patients.
All right, let me come back to Elder. Now let's talk about in the past. There was a question that somebody asked, a funny question, but please pardon me, I'm going to ask that question here. Someone asked the question, does kissing somebody with tuberculosis, the person who is being kissed, does the person come down with TB? Please help us with that.
I would say no. When we started, we had already explained that TB itself is an airborne disease, which means the only channel of transmission is through droplets or inhalation of air. And so kissing has nothing or has no connection with TB infection. So you can go ahead and continue.
Okay, so this is for couple because when the question was raised, it was really a matter of debate and all of that. I'm happy that you've been able to clear that. This is Let's Talk Nigeria. We're talking about tuberculosis because today is World Tuberculosis Day. You can call in 0812-723-7060 or call 009-230-0022. You can also send us your question on our WhatsApp number that you're already aware of, and you can also send a message to the SMS platform. We'll take a short break, and when we return, we'll continue with this conversation. Stay with us.
Coming right back. Just grab an orange, chips, and salsa.
Sparkling 92.3 FM, Calabar.
This is a replay of Let's Talk Nigeria on Sparkling 92.3 FM Calabar, making Nigeria better, one conversation at a time.
We talk everything. Health, education, finance, sports, transportation, agriculture, politics,
entertainment,
people and power. On Let's Talk Nigeria. Let's Talk Nigeria. Every day of the week from 9 a.m. to 10 a.m. Only on Sparkling 92.3 FM Calabar. Your radio, your charm.
All right, welcome back. Still talking about tuberculosis this morning. The song that comes to my mind is what we usually hear. Check out more, make you day sure. Right, tuberculosis is treatable. It is preventable, but you have to acknowledge that you have noticed the signs and symptoms and then walk into a health facility and get yourself tested and treated. And from what the officials here said this morning, that the TB treatment is free. So if you've noticed any of these signs, please walk into a health facility and do the needful so that we can find the missing cases, okay? Hello? Good morning to you. What's your name and location?
Yeah, my name is Dr. Henry. I'm calling from Calabar South.
All right, Dr. Henry.
Okay, very quite interesting conversation this morning. Very, very interesting. And my greetings to your guests in the studio.
All right. Well accepted. Go ahead.
Okay, now, one of the factors, one of the reasons why majority of Africans or Nigerians are having TB problems is number one. We as Africans must reduce excessive consumption of chemicalized food. For instance,
of what, please? I didn't get you, Dr. Henry.
Chemicalized food.
Okay.
Yeah, we consume chemicalized food too much. Number one, I don't want to mention names so that I will not indict people this thing, but we are Africans. Out of civilization and ignorance, we eat too much chemicalized food. Remember those days, I remember my grandfather used to take me to the farm. You know, people hardly, pharmacy now is everywhere, and people keep sick, dying, even chemicalized drugs.
Okay.
All those things, weaken our immune, the white blood cells.
All right.
So that's why it's easy to contact those diseases.
All right.
Thank you.
Thank you very much, Dr. Henry. Thank you.
You're welcome.
All right, Dr. Enoch, is there sense in what he just said about chemicalized food?
Well, I will say that I won't say exactly that chemicalized foods are one of the causes for TB. I think research is still ongoing, and I won't put it out completely that will not cause it.
You don't want to preempt research.
But I think we'll do more research on that to give a good answer to that question. But for now, I won't categorically say that it causes tuberculosis. But when we do more research, we'll have an answer to that.
Okay. Now, still talking about the treatment, I have a personal case, right, of someone who has been treated of tuberculosis and then the disease or the infection resurged again. What do you think might be responsible for that?
Basically, just like medications for HIV, before commencing TB medications, there must be proper counseling. The pill burden is there, where people take these drugs every day, and so they're not used to taking medications in their life. And then making them take the drugs every day is quite burdensome. Now, people can easily say they're taking the drugs and then push the drugs away and not take the drugs, and claim that probably they are up to date with their medications. But meanwhile, that very basically they've missed like 2 or 3 doses of those medications, and missing those doses can lead to resistance.
The TB drug resistance.
Exactly, resistance. That's where we have the people that pan out to be the DL TB drug resistance TB at the end of the day. They miss a month, miss 2 months, miss days, and it's not an antibiotic, it's not an anti-malaria. It's actually an anti-cox medication for tuberculosis. So basically, they've missed medications and then think that the miracle will happen just like that. No, you must be religious with your medications. Take it for the pound of time you should take it for, and then you will see results. Everybody that does these things religiously come out with good results.
Okay. All right, thank you very much. Let's talk more about this TB drug resistant, because like you said, the strain is really a dangerous one. Elder, I'd like you to elaborate on that.
Yes, you can have TB resistant. Like what Dr. Enoch just said, when you are not consistent in your intake of drug, and then if you are engaged or you are having any of these chronic ailments like cancer, diabetes, or you are into taking all these what will I even say, corticosteroid drugs, you are bound to be resistant to the TB drugs. In that case, it will be resurfacing on intervals. I think that's to add to what Dr. Enoch had rightly said.
All right, thank you. 08127237060 or 00923000022. These are the numbers for you to call this morning. Now, let's talk about this issue. It's a really turning one. It has to do with people living with, or people who have TB usually face stigmatization. Yes, I have seen it firsthand and all of that. They face a lot of stigmatization. How do we, and sometimes it is the reason why some of them do not want to come out to say, oh, I think I have TB and all of that. How do we stop this?
Yeah, I don't think if somebody should have tuberculosis, he or she needs to be stigmatized. No, because TB is unlike any other ailment, like malaria, like typhoid. I mean, and it's curable. Everything about TB is free. So I don't see any need why somebody should be stigmatized, because TB itself is an airborne. So it can happen to anyone. If you are not infected, you may be affected. So you don't need to stigmatize any. And funny enough is that as soon as you commence TB treatment, within 2 hours, renders you non-infectious. So
say that again. So if you had TB and you started treatment within 2 hours,
you are no longer infectious. Yes. So you don't need to stigmatize any. Rather, you should show love and kindness and see how you'll be able to guide or help the person to continue his intake of drugs, so he will get well at the shortest time.
All right. Dr. Enoch, can you throw more light on that in terms of the stigmatization?
You know, we are Africans. We are kind of very funny people. When somebody has a particular disease condition, we tend to push ourselves out of the way so that the person can deal with these issues alone. You know, it's a general norm, almost like a norm in the society. And now you find out, even when we had the malaria as in the 80s, when it came out, it was like a killer. People were scared and even associated with people. Then when HIV came out too, at the same time too, we found out that it also was a disease that if you say you have HIV, people will put away from you. But right now, we have people that are living with HIV and they are doing very well. So now, what we adopted was to get people that are on these medications and then have survived during the course of medications, come and be our preachers in the society.
Your ambassadors.
Yeah, ambassadors in society. Form peer groups, form community linkage groups. Go out, preach this message to them. I'm a survivor. So stigma is out there, and it's very great resistant to treatment. People try to hide, and when they hide, they reinfect family members. You know, TB it has history of contact. Basically, it was a history of contact. So if someone in the family has TB and refuses to get treatment, it can spread it around the whole family members in the household. So basically, we try to use survivors in the society that have been on TB treatment and have survived and are doing very well. Go out and preach message to them. Let them know that this is treatable, it's preventable. You can actually do very well after this disease condition. So that's one of the ways we try to allay the fears of the public on stigmatization of people living with TB.
Okay. Yeah. Now, a question that I have here is the same treatment course for adults. Is it the same for children?
Yes, basically it's the same for children, but not the same dosage. There's a cutting dosage for children, but the adults, it's the same medications, but it's a cutting dosage for children.
Okay, let's take this call. Hello.
Good morning, Ikongha.
Good morning to you.
Yes, I remember growing up.
Jenny, is that you?
Yes.
All right, go ahead.
Okay. I remember there's a place, with the opposite Monterey Hospital. Just almost directly opposite Blanza. You then walk inside the place they call TB colony. You go there and see men, women who have tuberculosis. Some of them even have leprosy. They are abandoned there. Some of them are just remaining. They are so skinny, just looking like skeletons. Remember, my mom used to cook food and go and give them during festive period. You understand? I don't know if government even know. I know those places are built by government. They are but they are not taking care of those people. They are just there languishing. Some of them die. They die on daily basis. I don't know even now.
Okay, Jenny, the TB colony you mentioned, is it here in Cross River State?
Yes, in Ogoja, opposite Munaya Hospital.
Is it still in existence till now? Hello? All right, Jenny, thank you so much for bringing that to our knowledge. I think you can call back if you still have something to add to what you've already said. Okay, so she mentioned something. Do you know of the existence of TB colony, Elder?
Okay, really, we don't have any TB colony in Cross River State, but I know that in 70s or early 70s, there used to be a colony for leprosy. Though Monaya, is a mission setup, is still being maintained. Not for the new persons now. It's for those parents who had leprosy and they have been living, some of them have remarried and they have gotten children and their children are doing very well. But because you are used to a particular community you were living in, they are still living there. But for now, we don't have anything colony. People come from their homes to receive treatment and retire back. And they are doing very, very well. So I don't think what she's saying may be right. Though she
said, why growing up? That was why I asked her if it's still in existence till now.
Monaya Hospital is still one of our centers. Is an admission site. People who can't come from their homes to receive treatment, maybe due to distance, may accept admission, and after a certain period they will be discharged home.
Okay. All right, Jenny, I hope you've gotten the clarification that you seek. 0812-723-7060 or 0809-230-0022. Hello, good morning.
Morning.
Yes, good morning to you. What's your name and your location?
It is breakdown.
Okay, go ahead.
We don't have TV.
So please, can you increase your voice? Can you project your voice so we can hear you better?
I say we don't have TV colony. We have a leprosy colony. Why? That was at that place that I consider it to be the Kwara, that is Monaya. But of TB, they used to send a sputum cup to health centers, even some medicine stores. Then they are collaborating to get the sputum into the cup to go and do the test. So please, we shouldn't be frightened concerning that of TB.
All right. Thank you. Thank you very much. All right, let's talk about the theme of this year. Yes, we can end TB, commit to deliver, right? So let me start with the state government, the Cross River state government. How are they ensuring that this theme comes to life?
Yes, our state government is really trying through the State Ministry of Health. One, by ensuring that human resource are on ground to carry out their activities and also engage themselves in maintaining the staff, supporting them, paying their salaries regularly. So I think the state government is trying, because if the human resource is not there and the office is not well equipped, you won't find anybody to attend to anyone. So I think they are trying in terms of government, of course, State.
All right. What about you, Dr. Enoch? How are you committing? How are you delivering?
As a medical practitioner, a scientist, we are basically going through writing of proposals, doing research, and trying to get grants from donor organizations to implement TB programs. There are many donors out there trying to see where they can invest their money And then if we project a particular condition in Africa, like we project a particular community that actually needs intervention in terms of TB epidemic, we could actually get their funding. And so far so good. We've had good funding from Global Fund, good funding from the USAID government, and we're waiting for more partners to commit. We have I think the TB Leprosy movement. We have the other organizations that are actually into TB that are actually sponsoring the TB issues in Nigeria. So there are people that are ready to commit and invest in this TB and deliver us from all this wahala we're having with TB. But where are those that writing proposals? Where are those going for the grant, writing proposals to get the grants in? So we as medical personnel and other stakeholders are trying to see how to do that. We also have private individuals in Nigeria. We have the rich guys in Nigeria that can invest into health to ensure that we get this TB done and over with. Like you said earlier, it's preventable, and if it's preventable, it can be done. So let's look for those who in the private stakeholders in Nigeria and find out how they can invest into TB, commit their money into it, and then sure, we can prevent TB in Nigeria.
What's the connection between tuberculosis and leprosy?
They are caused by two different bacteria. There's no, they're both an immunosuppressive condition, but tuberculosis and they are two different things entirely. There's no.
You mentioned TB and the leprosy movement. That's why I was asking.
There are people that actually putting the money into in passion for the both disease conditions.
Okay.
Because the both disease conditions can actually present so much stigma in the society. So when it happens that way, people try to push in money there to ensure that those people are well taken care of, and the stigma is. You see, like when we talk about the leprosy colony. You see, they put them all in one place because of the whole issue with leprosy, so that they get their healing and then get their drugs and then put them back to the society. So there's not too much connection. It's just that the people that the funders want to marry the two together to ensure they achieve their aim.
Okay. 0812737060 or 00923000022. Call in, ask your question, make your contributions to the conversation that we're having this morning about World TB Day. Today, March 24th, is observed internationally. The whole world is observing this day as World TB Day. And the essence is to amplify the urgency of ending tuberculosis, the world's deadliest infectious disease. And the annoying part here is that it continues to devastate millions globally, and the consequences are really huge in terms of the health consequences, the social and economic consequences, and it's something that we really need to rise up against, right? 0812737060. Now, today is the day, Elder. What is the state government doing this day to actually do something about it? Before you respond, let me take this call. Hello?
Hello, good morning.
Yes, good morning to you.
It's Uncle G calling from Calabar.
Uncle B?
G.
Uncle G, okay, go ahead.
Yes. I want to appreciate today's celebration, because the problem we have in Nigeria government has tried. There's no time the people that contacting this disease, they refuse to go to hospital. I have a friend that was detained in the police station. Unfortunately, he picked that TB. But it was. Hello?
Hello, Uncle G, we can hear you. Go ahead.
So,
please.
let us change the mentality. Our people, those that are contacting this disease, they should go to hospital. I hope the drug is free. But when you get that awareness, they will now say, people will talk, say, people are dying. Where are people dying? So the advice is, let us tell people the right place and the right thing to do. Thanks.
All right, thank you very much, Uncle G, for that. Thank you. Ma, you were going to say something.
Okay. The state government is actually trying. We started a week last week, Tuesday. We've gone to Gogo Market around the marina, to screen persons, went to correctional center. formerly known as prison, the markets, few markets we've sensitized and screened. And I want to tell you that for this short period, we've gotten no less than 30 TB cases. Positive TB.
So some people have it without even knowing.
Without even knowing. So, and all this is in support of the state government. So I think they are really trying, they are doing, but we also encourage they do more because we actually need fund. The unit actually need fund to do more than what they have done.
Okay. So if you currently notice the signs that they have listed out as being the signs and symptoms of tuberculosis, don't need anyone to tell you. This is your health we're talking about here. You need to take yourself to the nearest or the closest health facility. From what they have said, it is free. And this disease is treatable. It's also preventable, but when you come down with it, it is treatable as far as you adhere to the rudiment of the treatment, stay on course, do not miss out of any of the medications that you've been given for 6 months, and at the end of the day, you'll be well. And just like they said, if you had this disease, once you start taking the treatment, you lose the power to infect other people. So if you have a family member who has this disease, please encourage the family member to go to the hospital. Hello, good morning.
Yeah, good morning, Okamaka Richard and Patty, and your guest in the studio. So let me round up. Let me wrap it up. So by saying that the best way to avoid or to prefer solution is those foods, drinks, fruits that will weaken our immune system. We should avoid them. Prevention is better than cure. Rather than, going this, that. Those fruits and drinks that weaken our immune system, we should avoid them. Thank you for having me. Dr. Henry from Calabar South.
Thank you, Dr. Henry. We appreciate the contribution you've made. All right, so as we wrap up this conversation, let me hear the last words from Dr. Enoch, and then I'll come to Elder on this conversation.
Okay, thank you very much, my listeners. Thank you very much, Sparkling FM. TB is a preventable disease, and it's not what you should kill yourself over if you have it. Now we have a portable digital X-ray people right now in the state government, in the states, around the whole states, from the whole 8 local governments. We are being covered by portable digital X-ray. We have guys around these machines that ensure that they do testing and do a screening for our populace around the whole Cross River State. So please, when you see them with those machines coming for an X-ray of your chest, please do oblige and ensure that you give them your full attention. Today is World TB Day, so basically they are all out in the field right now working, from Akpabio, Bakassi down to the Obanliko and Obudu, all around the whole state. They are all present. We have our community workers, who we call community TB workers, also in the field, so doing screening, also trying to go from house to house to ensure that we screen people of tuberculosis, asking those simple questions, and if you have any of those questions ticked, we can also take your samples for your sputum for analysis in the gene experts. So please do not be scared of TB. TB is preventable. TB is treatable. TB is not a death sentence. Please come out and get your screening done. If you get screened, the more likely you know if you're free of this or not. So thank you very much, and over and out.
All right, thank you very much. To you, Elder, your last words before we call it a wrap.
Thank you, great listeners, and all those that have also helped in contributing. I just want us to take home that we can end TB. Yes, we can. How? By committing. Commit yourself. Committing does not necessarily mean that you have to bring out resources, but when you see anyone coughing out there, you encourage the person to access any of the closest facility. Then you have been able to rescue a soul. With this, we will know that Cross River State will be free of TB. And that's why our team for this year says, commit,
invest, and deliver. All right, thank you very much. Thank you, Elder Mrs. Ajom. Thank you very much. And Dr. Enoch Asuquo for coming to the studio. Thank you so much. And check out more. Make you day sure. That's how I say mine, right? If you notice this cough that has exceeded more than 2 weeks, or even within 2 weeks, please quickly go to the nearest facility around you and have yourself tested. And if it's negative, hooray! If it's positive, please commence treatment immediately. Once you commence treatment, the infection loses its power to affect other people around you. Remember that when one person is infected, it can affect 10 to 15 people. That's really scary, right? So yes, this is where we wrap it up for today's edition of the Sparkling Morning Show on Sparkling 92.3 FM Calabar. Thank you so much for allowing us to be your companions. And I have seen all your messages to be sent to Majesty. I will send them across to her. Thank you. Ukamaka Richard Bassi is my name. Enjoy the rest of today's broadcast. God bless you.
One. Music, sport, and talk radio. Let it hit 'em.
Ladies and gentlemen.
Sparkling 92.3 FM.